everyone. Welcome to another Convos with Coffee between two pelvic health PTs. We are really excited to share our journeys with you today. Whether you're considering a career in pelvic health physio or you're just curious about our experiences, we hope you find this video provides some insight and inspiration to you guys. So we're going to get started almost like a little interview style between Cindy and I, with first starting out on how we began as pelvic health physios, what drew us to pelvic health physiotherapy, and when we first heard about it. So go ahead, Cindy. When did you first hear about pelvic health? Did you always know it was a thing before you got to school, or
Not even. And it was
right?
only
No.
until our master, first year in masters, if I remember
Yeah.
correctly. And that semester we had optional courses that we can choose. And so there was this pelvic health courses. But in the beginning, I did not put it as my first option. So I wanted to take something else. But because my first option was full, that class was fully booked. So I got bumped into
Really?
my second option. Yeah,
Wait, which one
exactly.
did you want?
I
Sports?
think it was stroke rehab.
Oh,
Yes.
okay.
So yeah, so because that one got bulk, I was bumped into my second option, which was pelvic health. So that's how I got into this
Wow.
course, and that's how I discovered what it actually is because I didn't really know about what it is before going in.
Okay, just to provide some context to our viewers, Cindy and I met at that exact pelvic health course, except that was my first choice because I did not want to get into advanced sports and I didn't want to do stroke rehab. So that was the only other option for me. And I was like, oh, this is great. This is, yeah, my first option. And that class was strangely small. There was
Yes,
only six of us, right?
yeah,
Six girls.
6 girls.
Yeah, so we had a ton of attention, no TAs, just us and Claudia Brown.
Which I was actually great.
It was really great.
Yes.
Yeah. So I have a similar story to Cindy's, is I really didn't know much about pelvic health at all coming into the program. And then that course introduced us to treatment and assessment of female incontinence. And that was my first kind of gateway to learning about it. And that's when I realized that I had a bunch of pelvic health dysfunctions. And once I knew about that and knew there was a way around it, that's what really started the interest in sharing knowledge and becoming more familiar with the topics to treat my own concerns and then to help others as well. So,
Yes,
yeah,
and I was
very
really
interesting.
surprised when I got into this course to know that pelvic floor is actually a muscle, and us physiotherapists we're supposed to learn about all the muscles of the body, and then if
Right.
you're not in that course, you actually don't know about this muscle. So I was
Not
like,
too much.
hey, I know.
Yeah, exactly. Exactly. And
So that was very
arguably,
interesting.
same with medical school too, right? Like they are expected to learn all the muscles, but I don't know of a single doctor who performs like a really thorough muscular pelvic floor check based
Right.
on what I hear from clients. They have no idea what we're doing. We have we have very little idea of what they're doing. So yeah, kind of there's definitely an issue in the healthcare system in Canada with like everyone being siloed in their own specialties. We don't with like little talking amongst,
Yes. Lack
yeah.
of communication between professionals.
Yeah,
Yeah.
especially when because we're in private clinics as well. But that's a
Hmm.
whole other topic. Yeah, yeah, we're expected to know these muscles. I think Claudia did a one-off class for the rest of our cohort, but it was just scratching the surface of what we learned.
Hmm.
So yeah, without that course, I don't think I would be where we are today, right?
Yes.
Which is nuts. I can't believe that was a second choice for you. Holy crap. Wow. I
I
don't
was
think I
really more
remember
interested
that.
into neuro though at the
That's
time.
true. That's
Yes.
true. Okay, so Cindy, tell me about some of the difficulties in the beginning. So maybe even let's go before that, before practice. Did you take any other pelvic health courses while you were in school, or did you take I know you're going to talk about the micro program offered in Quebec. when did you take that? Like, when did you take more pelvic health courses?
Right. So for me, when I graduated, so that was actually 1 year after we've taken that first class, I think,
Okay. So
right?
you were
Almost,
working.
right? Because we graduated in 2016, and I think we took that
Yeah.
course in 2015, or like end of
Oh, I
2015
see what you're
kind of thing.
saying. Yeah, we
Yeah,
took that course before we graduated. Yeah, it was like
exactly.
embedded in our, yeah.
Exactly. So from since we've taken the course until graduation, I have like no other exposure to pelvic floor
Hmm.
physio. So like when I did my clinical like placements and stuff, I didn't have a placement where I got like mentorship from another pelvic health physios. So that's why when I graduated and when I started working in private clinic, I was in a clinic where there was also no other pelvic health physio. I didn't feel comfortable starting like something new in that clinic. So like really for the first year and a half, I didn't do any pelvic health physiotherapy. I was only doing like just like normal ortho stuff. And I was like, okay, I really wanted to do pelvic health, but then I was so scared to start something on my own in a
Yeah.
place that no one else has did it before.
Mm.
So that's why I was really hesitant. And it was only until after I switched to a new clinic where there was actually two other physio that practice in pelvic health that I started seeing my first patient.
Was the other person a new person on board as well?
No, the other two physios, they are much more experienced
Oh,
in
I
the second
see.
clinic, yeah.
Okay. Fascinating.
So yeah,
Um,
so I had like a dead period kind of thing,
yeah,
and
you had like
then
an
because it was still
interim.
like it was always like at the back of my head where I know that I really like this and I really want to like do like pelvic health related physiotherapy. So that's why I was like, okay, I need to like start somewhere. And I think that's also what pushed me to like change job because I wanted to go into a place where I can get mentoring.
Okay, can I ask you a question? What really, like those year and a half and that feeling of like, I really want to get into pelvic health physio, what sparked that for you? Like, why did you know that that was the thing that really interested you?
Well, I think first of all, I don't think there's a lot of pelvic floor physios back in the days when we
Mm-hmm.
graduated. Like there was, but like not as many as like now.
Yeah,
So I feel
yeah,
like I always felt like I remember like everything that we learned in class, and I know that like there are a lot of people suffering from like all these conditions that like they don't really talk about, and probably they don't think that there is help out there. So I always wanted
yeah.
to be like one of those person that can help them. That's why I feel like, well, a lot of like all the physios graduated from physio school can do what I'm doing now, but not
That's it.
everyone can do pelvic
Yeah.
health. So
Yeah,
that's why I'm like, I really want to do this.
absolutely. I think like it's almost like a business decision, right? It's like if I can stand out, then like I can really be unique as a practitioner, get a job kind of thing. Well, like how do I explain? For me, it was, you know, that I took the level 1, 2, 3 with Pelvic Health Solutions. That used to be owned by Nellie Fagani and Carolyn Van Dyken, and I think now it's just owned by Nellie. I took those on weekends during our following year while I was at McGill with you.
Mm.
And
Oh wow.
I felt like really prepared, like not prepared per se, but like really eager to start because I knew that the people in the courses were already building a caseload of clients in pelvic health. So their questions were really insightful. Like, my client has this, my client has that. And I'm like, dang it, like I have no experience, but all I'm just hearing are like other experiences of others. And, you
Mm-hmm.
know, it really would have been valuable to maybe even retake some of those courses while I had the clients, a caseload, a building caseload. But I really wanted to take them right off the bat to, again, learn more from a business perspective as well. I was like, okay, if I have level 1, 2, 3, I'm for sure guaranteed a job because not everyone has those as a graduating PT.
Mm.
And so I took those and actually in my last level 3 course found one of my bosses at the time. And she was like, hey, we're opening a clinic. Would you like to work there? So honestly, some of those courses were really great networking opportunities as well. So I took them before graduation. Like you said, yeah, none of my placements were related to pelvic health at all, which I kind of like in retrospect, if that was offered, I would have loved to shadow Claudia or someone in Claudia's clinic. I should have like maybe asked her because we were
Mm.
still, I think we still had two more stages or
Yes, before
left,
the
right?
end. Yeah.
Before graduation. So yeah, in retrospect, I probably should have asked. But yeah, all our stages were, yeah, I definitely was not in pelvic health essentially. So I came out feeling very eager, a lot of knowledge, but just no experience. I wanted to open my caseload right away. So that's kind of how I started, is just starting as like the solo pelvic health person at two clinics in
That
Toronto.
is very brave.
Yeah. I just
Yes.
felt like behind, actually. I was just like, oh, I can't wait. I can't wait to have someone book in. And it took a while. Like it took a while, maybe even like a year before I saw my first male client, and then maybe just a couple weeks for the other clinics to see my first female client. But yeah, it was very daunting. Like those first few initial clients. Is there any advice you would give for like those first few initial clients, like something you would have done differently? Uh, how did you prepare? Did you like scramble through your notes before they booked in? What did you do?
So usually in our clinic or in the clinic where I was working at, usually when the client books, like we have our secretary usually asking like what's the reason for consultation. So they would
Nice.
like give a little like summary, kind of like
Yeah.
why they need to consult. So like knowing what they're consulting for, then I will like review my notes, trying to like
Mm,
see, trying to really prepare myself, ask the good questions and all of those things.
yep.
Yeah,
And did
yeah.
you use a template as well? Like you had a piece of paper and you're like, okay, don't forget to ask about this score and this thing. And
Yeah, I feel like our assessment form is really well made. And also
okay.
at the clinic where I was working, the other like really experienced pelvic health physio, she
Oh,
had a really like thorough intake form. Like even her intake form also asked like really detailed subjective questions about like bladder habits, bowel habits, like food, everything. So like following her form, it was like really good. It made me feel
okay.
much more comfortable
Nice.
and then like you're not gonna miss stuff. So yeah, I think that really helped me. Also,
Okay. Is that
yeah,
something the client fills in before they see you? So you have all the
yes,
information? Okay,
yes. And
interesting.
then you can also
Yep.
go over that with them, which actually saves a huge amount of time for this objective
Yeah.
part because
Yep.
that really already gives you a lot of information. So that was really good. And then also in my the so like the other courses that I took afterwards
Yep.
in pelvic health in the micro program, like one of our like homework was to make an assessment form. So also like from there, I was like more prepared, making
Okay.
like every assessment, like all the different assessment forms for female and male, like different conditions and things. So
Gotcha.
yeah,
Okay. Okay,
yeah.
really cool. I think for my two different clinics, we had different systems. Like one was a JNAP system, and the other was like these are EMR systems in Canada. The other one was like a generic one that didn't have templates already built in. So for one of my clinics, I would have all this intake information, which I would review and like scramble through my notes to see what I could do. And then for the other site, it was tricky. So because there was no intake form, what I would do is I would personally email them on their, like, as they book in, they have to put in their email. I would ask what their primary concerns were and then hope that they would respond and review from there. But
Oh, okay.
yeah, but well, honestly, once in a while, because of confidentiality reasons, I think
Mm.
that's why I wouldn't get a response, and so I would just have to wing it on the
Mm.
day that they came in. So
But doesn't
uh,
that give you extra work too?
in the session, in
Or
the
do you do
session
it
meeting,
before you see the patient
for which
to
for
get more information?
yeah, like the administrative work, you mean? Like,
Yeah,
hi, blah, blah, blah. How are
yeah.
you? Da, 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 da. Yeah, that's a lot of work. That's a lot of work. I don't do that anymore
Okay.
because I feel more confident in whoever comes in with whatever thing. If I don't know, I'll just say I don't know. But yeah, back then it was a lot of work because
Mm.
you might be potentially emailing three new pelvic health people every week and then
Mm-hmm.
following up with like what they have. That's the thing. At the beginning, it wasn't that busy though for me. I was
Hmm.
definitely seeing more ortho clients, so I didn't feel like it was that much admin work. I was also single at the time, so like no family responsibilities. I was like, whatever. This email
You
like
had
doesn't
time.
feel like work. I had time. So it didn't feel like that much of a burden that you're making it out to be, but it felt
That's
like
how
dull.
Jane spends her weekend.
Romanticizing, yeah, emails to my clients. So yeah, I felt that was really useful though, because that
Mm,
helped me review things about hemorrhoids or like what we could do for someone with constipation. Yeah, now it's so routine, I'm sure for us now, but at the beginning it was tough. Like it would be like, oh, I forgot that question. Oh, I didn't ask them about that. That was a big mistake. Oh, I forgot to ask about diet as well.
mhm.
Like you will forget. So having a template in front of you can be really helpful.
Yeah.
And honestly, the way that I practice now, so yeah, I'm gonna ask you, the way you practice now, is it pretty much the same, like the same intake form, or are you more like laissez-faire with it because you know which core questions are the ones that are very important for specific like conditions also. Like for a constipation client, you're not going to spend forever, like a 30-minute time, unless there's like some sort of trauma or some reason you're spending, like in sexual health, you're going to spend a lot of time in bowel based
Hmm.
questions, right? So I think now like it's a little more freedom of like where we take the interview. But at the beginning, I felt very rigid. Like I was like, I have to ask
Yes.
all these questions. I have to get it. Yeah,
Yeah, definitely. And I think now, like the assessment form is really just like there as a reminder. But yeah, like you said, we're more, I guess, like more used to knowing which questions to ask. And even sometimes I will like add stuff out there on my own or like delete
outside.
stuff. And yeah.
Yeah, maybe we should do, yeah, something in the future where it's like specific special questions to ask for like certain conditions because there is some nuanced questions that's not in the generic
Mm-hmm.
subjective interview that you may find helpful in later treating.
Yes.
Yeah, we'll talk a bit about that as we build our Stubby Nails Club content. Okay, let's talk about some of the difficulties at the beginning. Let's talk about like everything, like from caseload to difficult clients to difficult, like their social status. Was that difficult to like your employer, to like education fund and finance it? Like, what did you find difficult, specifically in your pelvic health caseload at the beginning?
I feel like one of the difficulty I had was like, so if I back up to my story,
Yeah.
so when I changed clinic, like I said, that's where I started seeing like my first pelvic health patients. But I wasn't seeing a lot of them because my boss was really making sure that we like that the person who's like let's say taking the appointment, we're really scanning the patient well to make sure that that person only
Oh,
has like urinary incontinence because that's the course we took back in the McGill, right?
oh, I
So she
see.
wanted to make sure that I'm actually just treating what I learned and that I won't get a patient that I'm not familiar with because
Yeah.
that might also like decrease my confidence in myself if I don't see results, or maybe that's also going to ruin the reputation of the clinic, seeing someone who doesn't know like what she's doing,
100%.
right?
What
So
do you,
that's why I was like really limited in the
yeah,
client that I can see, but
yeah,
definitely I was able to help that person because I know what I'm doing.
okay.
But then obviously I don't get a lot of like cases because
Yeah,
you really have to like that person has to like really specifically fall into that category, which now like we know it's kind of rare sometimes because you don't get someone who only has like urinary like stress urinary incontinence. A lot of times it could be like mixed with like other conditions, other problems, other dysfunctions. So yes. And
100%.
I think
Yeah.
that's also why when I started, that's also what made me want to like pursue further. So I can also see other cases, other kinds of conditions. And that's when I went into like the University of Montreal to do the micro program.
Okay. Yeah.
Yeah.
Wow. Really interesting. Yeah, that would totally limit the number of clients you could see. I don't think, like, I can't even count on my hand the number of clients I'm seeing right now that just want leakage management. Like, I think there's
Mm-hmm.
none. I
Yeah.
just like, because we know the pelvic floor has like 4 different functions. Yeah, if there's an issue with leakage, there's likely an issue somewhere else, right? So it's pretty rare. So that kind of brings me back to asking you, like, do you feel as if we as generalists, when we graduate from PT, do you think we absolutely need levels 1, 2, 3 or the equivalent in Quebec? Like, you absolutely need the micro program before starting as a solo pelvic health person without, like, let's say you didn't have a screen, someone to screen.
I definitely feel like if I were to do this all over again,
Yeah.
maybe I would have go into the micro program sooner.
Okay.
Because then I get
Okay.
like I would learn the knowledge a little sooner, so then I can start having a bigger caseload in pelvic health and feeling like much more confident having the knowledge. I feel like that's maybe what I would do differently. And I feel like in Quebec, the micro program is really built in a really nice progressive way because we're learning like we have one course per semester.
Okay.
And then every course is on like a dysfunction. So like let's say we started with like female urinary incontinence, and then it was like the pessary course, and then it was like the
Wow.
male urinary, like male like pelvic health
Yeah.
dysfunction course, and then it was like the pain course. So like everything is like one after the other. And we could, because we are already practicing physio, that's why like every time after the course you could already apply it into like your work. So let's
Gotcha.
say like you got the
Okay.
course on the weekend and Monday you see exactly the patient who's consulting for exactly what you just learned, like it's great. And you could
Okay.
like continuously build on your knowledge over the like over the period of 2 years, because that's how long the program lasts. So that I feel like that was a really good like learning experience. And
How much is it? Can I ask?
I don't remember how much it was, but it was so because it's a university course, it goes with how many credit
Oh.
the course is.
Oh, so this was like tuition. This was not a
Yes,
private
tuition.
company.
No.
Okay. Okay, that's interesting because Pelvic Health Solutions is a private I believe, a private company. It's definitely not attached to any university, and the courses run around like I'm gonna guess when I took it about $1,000 per level.
Mm-hmm.
Now they're probably a bit more, probably 1,500, 1,400, 1,500. Don't quote me, but for a weekend, it wasn't as laid out as yours is weekly, was it? It wasn't every
No,
day,
it
it
was
was weekly.
no, it wasn't weekly. It was like let's say we have like one course per semester, so
Okay.
that course might run depending on how many credit that course is. It could be just like 2 days over the weekend, or
Oh,
sometimes it could be like 4 days, so 2 weekends, or 6 days, 3 weekends.
oh,
So it really
okay.
depends, but I don't think it's ever longer than 6 days.
Okay. And it was all in consideration that you're already an existing practitioner
Practicing
practicing
exactly.
physio. Okay, same.
Yes,
Okay.
but I know that the people in like from the University of Montreal who's in their like master's years, they could
Yep.
already take the
Oh, have
take the
taken.
first course. It's like similar to what we did with Claudia Brown and McGill.
Okay.
Yeah.
Okay. So yeah, similar to the Ontario system, like, and keep in mind, guys, like you don't have to take these two courses or these from these two companies if you're in Canada and wanting to practice as a pelvic health physio. You could travel to the States and take Herman and Wallace courses and then come back and get rostered from the Ontario College. I don't know if that's similar with Quebec, but you're not married to a Canadian teaching school, is what I'm saying.
Mm-hmm.
There's also Claudia Brown's private teaching company called Eurosante, who
Yeah.
does like those early level courses. And so for Ontario, it starts out as male and female incontinence is level 1. Level 2 is male and female pelvic pain, which is really widespread, right? Like vulvodynia, vaginismus, any penile, scrotal pains, endo, bladder pains. Like it was just huge. The content was huge for that second course. And then level 3 is persistent pain for men and women. So yeah, it's interesting because like the pessary course would have been an additional weekend course for us. It wouldn't
Mm-hmm.
have been included in those, yeah,
Yeah. We
in the
also
private
had
program.
like the last the last course from this program was like on the special population. So we had little
Okay.
like talks from like pediatric pelvic health, and
Ooh.
then like transgender pelvic
Yeah.
health. Yeah, so
Yeah.
like a bit of
Nice.
the special population stuff.
Oh, that's really cool. I wish there was something like that here, honestly, because it sounds like it was really like broad. You guys cover
Yeah,
pregnancy, prolapse, and
yes,
postpartum and
yeah.
running. And that's
No, running was a different course.
okay. Okay.
But I feel like overall, this program is pretty well made because, like you
Yeah,
said, it has covered a very broad topic, and I have like completing this program, it really made me feel like much more like confident.
confident.
Yeah.
Oh, awesome. Awesome. Did you get to shadow your physio as well? Did you have some opportunities to shadow?
Yes, I did, and I feel like that also really helped. She was
Okay.
a physio who was seeing more like male cases. So
Oh,
I actually got some like really good like tips from
that's
her
so
treating male,
cool.
even though back in the days I didn't treat males because I haven't done the male course
Oh,
yet. But yeah,
oh, I
it was
see.
really really nice to have mentoring from someone.
Okay, that's really lucky.
Yes.
I Yeah, so one of the clinics that I worked at was Cairo owned and did not, like, there was no pelvic health physio there. The other one actually was co-owned by someone who took that course with me. So she was a pelvic health physio, but she just gave birth, had a baby, and wasn't working that frequently. So our times wouldn't mash up together. And in fact, I think I was taking on at that time more of the pelvic health caseload than she was. So yeah, our schedules never matched up. We were kind of at the same like educational level. So I really wish I had mentorship. Um, yeah, I think that would have made a big difference. Like even just in some of the explanations or the demeanor, like how you approach telling someone they have a grade one prolapse, or how do you explain the pelvic floor in like lay terminology? Even like seeing that would have been really helpful, I think.
And I feel like you said I was really lucky because in our courses, even when we took the male courses, we don't actually have a male patient. So like actually seeing someone in clinic, how to approach a male patient, like about that
Yeah,
area, like what
so
things
rare.
not to touch
Yeah.
and stuff like that. You just have to be like respectful and how like to treat. I feel like that is like was a really good plus for me.
Oh my gosh. Yeah, that's incredibly rare. Like, because
Hmm.
first of all, in those courses, like, there's never a male present. At least for us, I think there was one male, and like we were all trying to like look under his like bed sheet because we're like, oh my gosh, we've never seen a male before. We need practice on you. And the poor guy. But uh, most people won't see a male in their courses, and the first male pelvic floor that they're seeing, which you guys drop an eggplant if that was the case, in the comments. But yeah, it's really intimidating to see your first male client and how to approach asking for an internal if they were surprised or yeah, yeah, that's really
Yes.
valuable. I don't know you, I know you do clinical mentorship with students. I've offered in the past, I still do this from time to time, but not as much, like shadowing opportunities for mentors that book in privately with me. But I'm trying to do that a bit more within the clinic itself and grow with my current clinics. Pelvic health caseload because I'm
Hmm.
starting to get too busy. But that would, yeah, that's stuff that I think would be really valuable to a new practitioner. So if you guys have opportunities to shadow, take it. Like if it's for free, take it. I know through Pelvic Health Solutions, it costs money, so that's what deterred me initially, but maybe I should have invested and just like, let's see how someone who's been doing this for 15 years does an initial intake, does, you know, her follow-up appointments. I think that would have been tremendously valuable. So, Cindy, I know we've spoken in the past where you've been really, really, really lucky in that when you just take like the pessary course or you just took the pelvic pain part of the course, you suddenly get an intake that's like pelvic pain, or you suddenly get an intake that's prolapse, and you're like, I know what to do with this.
Yes.
So that's really lucky.
I
Obviously,
know. I don't
for
know why, but I was like super lucky about this.
Because for me, it was like kind of a nightmare. Sometimes I remember taking levels 1, 2, 3 and getting a few pregnant clients, and I'm like, I don't know what to do. Like we didn't really talk about pregnancy too much, just as like a higher risk of like certain pelvic girdle pains or like a higher incidence, obviously, of like incontinence. But we didn't really talk about like what you can do through the trimesters, what you can do beyond perineal massage. Like to me, it was just like, okay, well, you're coming in way too early. Just come see me week 35 and let's talk about perineal massage. No,
Mm,
it's so much more than that. And like, had I not taken more courses like the pregnancy perinatal course, I would have, yeah, absolutely been giving like way too little information
mhm,
and uh, guidance for the pelvic floor, like what you can do during pregnancy, what you can do to prepare the pelvic floor for birth and reduce the risk of injury postpartum or during the delivery. So, for me to overcome those initial challenges of not having a mentor, I basically just bombarded myself, like took a bunch of courses initially. And this is actually something I don't recommend that you do. I think I took about 2 courses per year initially, maybe even sometimes 3 courses per year just to beef up my credentials, beef up the number of people I could see. I figured like, hey, if I take a pediatric pelvic health course, that means a bunch of like parents and kids are going to flock to see me because I don't think I've ever seen like a pelvic health, pediatric pelvic health person work near me. So I just assumed that taking more and more and more courses means more and more people would come see me, but I wasn't really marketing myself very well at that time. And I also wasn't applying a lot of the information that I learned because it was a lot of information. And as you know, like these pelvic health courses are all usually like very condensed weekend courses. So that like if you don't apply the information right away or practice the skills, practice those treatment skills or assessment skills, you lose them so quickly. And so my advice for that is more so I would have sought a mentor over taking a bunch of courses initially. I think that would have been more valuable. And if I did take a course, I would absolutely recommend taking the pregnancy perinatal course first if you're someone who's not not in Quebec taking the micro program, which by the way, was that taught in French or
yes,
taught in English? Okay, it was
it
taught
was
in
taught in
French.
French.
And that's
Yes.
the only option, right?
Well, that was the only option, or you can take Claudia Brown's courses. So if you're in Montreal, those are your two options for like getting like the pelvic health courses.
Okay. And
Yeah.
honestly, some of those Claudia Brown's Eurosante courses, they're also in French, right? So you kind of have to like wait for the English cohort or the French cohort of the
Yeah, I
class,
think they
right?
have both groups. Yes.
Okay. So
Yeah.
it's a little tricky. I think trickier if you're in Montreal and only Anglophone, or
Hmm.
you can't even be only
You
Anglophone.
can't, yeah,
So
if you practice in Quebec, you have to speak French, so
okay, okay, there you go.
or else you don't get your license.
Yeah, I don't know how you flip-flop French and English pelvic health terms, but that's very impressive. Um, okay, where was I going with this? Overcoming initial challenges. So I just took a bunch of courses. I wouldn't recommend this to you guys if you guys are new and you're like, I just need more courses to gain more confidence. That's not it. It's in fact, I took a bunch of courses. I don't remember what I learned in many of those courses. And it did not happen for me. Like, I didn't see a single PEDS case. I didn't see a single oncology case until like last year. What other courses did I take? Like, just because you took the course and you may be advertising it on your website doesn't mean people are going to flock to come see you. So we'll have another, probably like another video on branding and marketing soon, but yeah, I would recommend just taking maybe one course, if any, after your levels 1, 2, 3. Like first absorb that material, sit on it for a while, practice all the applications, see what who it works for, who it does not work for, and then slowly accumulate course by course. That's probably how I would recommend, but I overcame the challenge by basically getting in the reps. Like it took me a very long time to feel confident, but I think when my pelvic caseload started to be more consistently 50-50 ortho, 50 pelvic, um, I started gaining more traction and getting more word of mouth referral and started feeling more confident, seeing different conditions through just repetition, seeing what worked, and kind of like a almost like a trial and error, right? This doesn't work for this person. This works for this type of like person. But that's slow as heck. Like I feel like if I had a mentor to kind of navigate me through that, that would have been way quicker than me trying to like guess certain things for certain different categories of people or populations. What do you think about that?
No, I think I definitely agree with what you said because I also went through like the same thing. I took a bunch of courses, like not in pelvic health, but like in orthopedic. So like after I graduate,
Oh,
I took like
huh.
a bunch of courses in orthopedic, because I want to like increase my like the tools I have in my toolbox in order to like give better treatments, in order to like help
Yeah,
more people and just to feel confident. So yeah, and I definitely agree that when you take a lot of courses in the beginning, you don't get the time to absorb everything and then you forget because you're not using everything. So definitely it's important to like maybe don't take like a lot in the beginning, like choose, maybe ask other people around you, other like more senior like physios, what would be the most recommended course in the beginning to take, or like what you
100%.
like choose something that you really like and then take that course and then like use the knowledge from that course for like consistently for a period of time until you absorb everything and then thinking about taking a new course.
Absolutely. Yeah.
Yeah.
Um,
I also wouldn't like regret all the courses I've taken,
yeah.
but it's just like all the money I've spent on it.
They're not cheap, especially when you're
They
just
are not
starting
cheap.
out. Yeah, and you're just,
Yes.
I mean,
But again,
yeah,
like back in the days, I still live with my parents. I don't have to pay for rent, so like
great.
everything I earn, I like just reinvest
Reinvest. Yeah,
into
I
my
hear you.
courses, so which was okay. But yeah, if you have like family to see and other things, you might not have like all that money to put into courses. So
For
really choose,
sure.
yeah, what you like or what's like more important for you.
Okay, this is a really great segue into what courses, conferences, other instructional like education that you have, like personal training or whatnot. Like, what was the biggest, best investment for you if you could put it in like a top one, two, three? Like, which courses were the best? Which conferences were the best where you took away the most?
Well, if we really talk about pelvic health, then I would definitely recommend the micro programme that I did in with
Mm-hmm.
the University of Montreal because,
Mm-hmm.
first of all, it's really well organized. It doesn't make you feel overwhelmed because it introduces like one topic at a time, so which also gives you the time to practice in between. So you really
Mm.
get the chance to like absorb that knowledge. And second of all, it's not that expensive compared to like a course given by a private
Oh,
organization, because it's more like tuition based, so it's more affordable. But I feel like maybe the downside would be it's over like 2 years, so you have to be patient. So if
that's
you really
true.
want to get a lot of knowledge in like a short period of time, I guess this is not for you. But like I said, it's really, I feel like it's organized in the way that it really gives you the time to like sink into it and like apply the knowledge and you don't feel like overwhelmed. So if you
Okay.
want to take your pace, I feel like that is a really good option. Or if you are like short on budget also, I feel like that's a good option.
Okay.
Yeah, but also be mindful, they do, so when you apply for these courses, I think they do look at your grades because a lot of people apply
Hmm.
for it and they only take I think 30 per year or so.
Oh, that's interesting. I didn't know that.
Yes.
Okay.
So they only, I think 30 or 30, I don't remember the exact number, but they only take a certain number of people. They also don't want like a huge group, right? So yes. So
Yeah.
I think it's, and so I think it's like grade based, yeah,
Grade
based
based.
on like your
Okay.
grade. Yeah.
And I know we have a mutual friend who took the micro program, but actually dropped out. midway through.
Yes,
I'd be curious to know why. I don't remember why. Do you
you can
remember?
also drop out like let's say if you're only interested in the first courses that was offered in this
Oh,
program, take it and
okay.
then you don't want to continue, you just don't continue. It's fine. You're just not gonna get
I
like
see.
the diploma at the end,
Okay,
but
but
you
you
still have your
still,
knowledge, right?
okay, and you don't pay
Yeah.
for the second. I see. Okay,
Yeah.
maybe that's why. I don't know. Maybe
Yeah,
I'll
there are
look
people
at the
doing that
comments.
though. In
Oh
like
yeah?
in my group, we had like the most people in the first course, and then it kind of like slowly
Oh,
decreased.
it just petered off. Okay.
Yeah.
Okay, interesting. Anything else you would really recommend for
Mm,
let's say for a beginning pelvic health physio? Like what do they need? What do they need in the beginning?
I feel like if you do get to get a job in a clinic where you can get mentorship, take it.
Yeah.
Even if it pays less than another clinic who like doesn't have
Mm,
mentorship, because I feel like that could really like help you build a lot more confidence, like help you navigate through the more complex cases, and
yeah.
which will help you build more skills faster.
Yeah.
Yeah.
Oh, okay. I'm putting in a shameless plug here that if any of you guys are new pelvic health PTs in Toronto, contact me through Jane the Physio or pelvicprophysio@gmail.com. We'll put it at the bottom of the video because my clinic's looking into that soon enough into more like clinic mentorship and doing like small group rounds and talk about difficult cases together. So it doesn't feel isolating as it was for us when we first started. But yeah, shameless plug. If you guys want to work in downtown Toronto, just send me an email. Okay. Um, for me, my top courses I would recommend in the beginning as an Ontario public health physio would have been definitely the pregnancy. Like I'm assuming everyone's taken the level 1, 2, 3 already. From there on, I would take the pregnancy and perinatal course offered by Pelvic Health Solutions. That was really instrumental for like demystifying a bunch of like pregnancy myths and pelvic girdle pain myths. So that was really, really, really important to take DRA as well. That's changed so much over the course of our practice. That the discussion surrounding diastasis rectus abdominis. And then as a new pelvic health PT, I don't know if you disagree because we took this course together, but I would really encourage people to take Ramona Horton's 4 courses. We've only taken one, but she has 4 courses in the visceral fascial mobilization category, like visceral fascial mobs for the GI system, the urinary system, and the reproductive system, and then a myofascial course that she teaches. So I would recommend those 4 courses, even if you're new to practice, actually, because I feel like it opens you up to a world of another system in the body that probably a lot of practitioners like RMTs, chiros aren't using in their practice. So it gives you a kind of a level up and also another system. And honestly, it's been so helpful for my clients now that I've implemented a lot of those techniques. It's kind of mind-blowing how different my practice is since taking her course. So I would highly
Hmm.
recommend Ramona Horton's courses. If you can go to the States, go to the States if you can't wait. Because I think she only comes once a year to Canada. Let me see. Would we do anything differently? I feel like we touched on this a little bit. Like, yeah, we would have both wanted more mentorship, maybe more shadowing in our
Hmm.
early years, even as a student. That's tricky though. In Ontario, we can't, I don't believe you can be rostered as a PT student, so you can't do internal techniques as your
Mm, okay, I
in your
see.
stage. What about Quebec? Can you like certainly they could probably shadow you and just kind of
Actually, I think in Quebec, if you have taken I guess for you guys it's the level one. So if you have taken a pelvic health courses, either it's Claudia Brown's
oh
like female urinary incontinence or it's from the university, like also female urinary incontinence, then you are allowed to do internal.
really? Even if you're
Yes.
not a physio yet?
Yet. Yes.
Okay, that's
But you
interesting.
have to be supervised by
Okay.
a physio, obviously. You're not doing anything alone.
Yeah.
Yeah.
Okay, I see. Okay, interesting. Yeah, in Ontario, I don't think that's possible. So, okay, very interesting. Any concluding statements or advice you would give to new pelvic health PTs or anything you haven't mentioned in your journey that you want to express? Because you've been in the industry you for
Yeah.
9 years, 8 years?
No,
No,
7.
7
Didn't we
for pelvic
graduate at the
health?
same time?
Yeah, but I feel like I consider my early years like taking the courses as I guess counted as years
Oh,
learned.
okay. Okay, I only
I
counted
think
like
so.
after I graduate.
And are you counting your first year or no? Only when you started
Yes.
training?
No, I'm counting everything, like when I
Oh,
started my first job, let's say.
okay. Okay. So it's
Yeah,
about 8 years. It's been 8 years, 2016, 2024.
almost, yeah.
Yeah, about 7 to 8 years. Okay, that I thought I was in this for longer than that. Wow. Okay. Yeah, any advice you would give someone who's just starting out? I know you had mentioned if your clinic has a mentor, really
Mm.
latch onto them, shadow them, see what their challenges are, and yeah, any advice?
Well, I feel like if you are starting in public health and if you're really sure you want to do public health,
Mm,
like go for it because there are actually a
mm,
lot of people like who needs your help.
yeah.
But if you don't feel confident, then don't be afraid to like reach out to have like mentorship or even to, I don't know, cause well, I guess for us in Quebec, we have like a Facebook group where for all like the public health physios. So like find those like groups where you can like ask questions, where like other people, other health public health physios can also brainstorm with you on
Yeah,
complex cases. Yeah, just like don't be afraid to like reach out and ask for help.
100%. Nice.
And if you can, like then start investing and doing like other like courses to deepen your
Mm-hmm.
knowledge and expand your skills.
Mm-hmm. Mm-hmm. The only extra things I have is we have something similar to that as well. There's a pelvic health solutions Facebook group that will consult like difficult cases or difficult questions or one-off questions. There's usually a
Hmm.
lot of community building and like someone will help you answer the question. There's also what I would say is if you are taking a course, I would actually recommend that you sit around in different spots for every single day of the course and meet someone new because you may find that in your labs, you're learning some more techniques because those people that are learning with you, especially when you go beyond your level 1, 2, 3, they might be a senior physio, a senior pelvic health physio who's been doing it for decades. They may be able to offer you some insight into um, something else, like a technique that is taught in the class, but they have a different approach, or they
Yeah,
have some insight on how to deal with difficult parents if they're a pediatric pelvic health physio, or their little systems like Embodia, or like their little app systems to help communicate with their clients. So don't, yeah, get comfortable in your social bubble. Try to actually meet more people in those courses. That's a perfect opportunity to learn more from someone who's been doing it. Maybe even network a possible future career with another clinic or that like aligns with you a bit more. Um, or just learn more things in the lab because everyone has something to bring into that lab, those lab hours as well. And yeah,
that's
just
very good
reiterating,
advice. Yeah.
right? Like a lot of people just stay in their group, like just go with a friend and stay stuck. I would say like spread out a little bit. Um, and then for the mentorship thing, finding someone that really aligns with you, because I feel like not every mentor is going to be the one for you. You want to be picky, and so maybe just doing like a one-off hour with a mentor initially, just to see if you guys match energy wise. If you are going to go the mentorship route, or contact someone like a neighboring um, pelvic health clinic and just contact that pelvic health physio through their clinic email and be like, hey, I'm a new pelvic health physio. Can we get in contact and talk about cases together? You might be surprised. Like that person might also feel isolated in their clinic and they may want to work with you in that sense. So building your own study groups, building your own clinical kind of like question groups. We sort of had that in the beginning, I think, with Haya. So like I feel like
Mm,
having that little small group study is really important as well,
yep.
especially if you're the only one there.
Mm-hmm.
Okay, lots of good information. If you guys check out our earlier videos, we have a video entitled 3 free resources that every pelvic health PT should jump on. Guys, go watch that video now because that provides a lot of valuable information, especially to new pelvic health PTs. Yeah, we hope you follow those accounts as well. And it's completely free. So, yeah, very valuable to just keep an ongoing resource platform. What am I trying to say? Um, Really important to just stay current with the pelvic health knowledge with these current platforms. They're very applicable to day-to-day pelvic health PT struggles related to everything: finances, burnout, hiring, firing, asking for a raise, um, pelvic PT knowledge in pregnancy, perinatal, like staying on in line with trends as well. Because we all know like this industry changes so often with like a new device, a new toy, a new research that's coming out. So following those free resources will really help you stay current. All right. Thank you guys so much for watching this video. If you guys found it really helpful, then we encourage you to share it with a friend who's starting out in pelvic health PT. Like the video, share the video, subscribe to us, and yeah, we hope you guys follow our Stubby Nails Club Patreon group, which is a small fee every month, but we provide a lot more hard skills education, soft skills education as well, but much more value in that account as well. So, okay, we hope to see you at our next video. Take care and thanks for watching.
Thanks for
Bye.
watching.